All right, let's draw the brachial plexus. And as we do, we're going to learn a brachial plexus mnemonic, and we'll also label the nerves of the brachial plexus and talk about what they do. I'm Parker, and this is Anatomy with Parker Ballard. Before we get started, I want to give credit to Mark Nilsson, who is an amazing anatomist and teacher at the University of Utah. This is a mnemonic that he came up with to help learn the brachial plexus. And the mnemonic goes like this. You young mermaids, line up in front of Poseidon's ultra trident, LSD salts, made many mermaids undergo mass misery. And then Robert Taylor drinks cold beer. So it's a little bit of a longer mnemonic, but it's going to help us draw and label the brachial plexus. On the screen, you'll see the first part of our mnemonic, the you young mermaids. And so we're going to draw two Y's for the you and the young, and then we're going to draw an M for the mermaids. Then next is line up, so we're going to draw an L-shaped line up between the Y's. And at this point, we can see all the spinal nerve levels that contribute to the brachial plexus, so we'll add those on the side. Then you'll remember from our mnemonic that we line up in front of Poseidon's ultra trident, and so we'll add a three-pronged trident here behind the line up we just drew. And since it's an ultra trident, we can use those letters to label the branches that are coming off of it. And you can see that the branches actually spell utlera, but we just use ultra in the mnemonic because it's easier to remember. And if I'm being honest, an ultra trident sounds a lot cooler than an utlera trident. So the U in ultra represents the upper subscapular nerve. That comes from C5 and C6 and innervates the subscapularis muscle. The T represents the thoracodorsal nerve that comes from C6 through C8, and that innervates latissimus dorsi. The L is for the lower subscapular nerve that comes from C5 to C6, just like the upper subscapular. And like the upper subscapular, it innervates subscapularis, but the lower subscapular also innervates teres major. And I remember that because teres major comes off the lower portion, the inferior angle of the scapula. Then the R is for the radial nerve that comes from C5 through T1, and that innervates all the muscles in the posterior brachium as well as the posterior antebrachium. Then the A is for the axillary nerve from C5 to C6, and that nerve innervates deltoid and his wife who's finer, teres minor. And now that we're done with the ultra trident, we're going to move on to the LSD salts. And so for the LSD, we're going to add a few branches here coming off the brachial plexus. The L represents the lateral pectoral nerve from C5 through C7, and that nerve leaps over pec minor to just innervate pec major. S is for the suprascapular nerve from C5 to C6, and that innervates supraspinatus as well as infraspinatus. Then D is for the dorsal scapular nerve that comes directly off the C5 ventral ramus, and that heads back and innervates levator scapulae as well as the two rhomboid muscles. Now we'll add a few more branches for the salts portion of the LSD salts, and you'll see this longer branch is going behind the ventral rami, and it has connections from C5, C6, and C7. The S is for the subclavian nerve from C5 and C6 that innervates the subclavius muscle, and the A is for the accessory phrenic nerve, which is actually an anatomical variant, and you won't have to identify that in lab. Then the LT is for the long thoracic nerve that we saw came from C5 through C7. That nerve innervates serratus anterior, and if that nerve is injured, then a patient would have a winged scapula. And going back to the mnemonic, we know that these LSD salts made many mermaids undergo mass misery. So for the next part, we're going to draw three branches off the medial cord for the made many mermaids. And the most proximal M is for the medial pectoral nerve from C8 to T1, and the medial pectoral nerve marches through pec minor to also innervate pec major. The next M is the medial brachial cutaneous nerve from C8 to T1, and just like the name says, that does the cutaneous innervation to the medial part of the brachium. Then the most distal M is for the medial antebrachial cutaneous nerve that also comes from C8 to T1. And just like the name says, that does the cutaneous innervation to the medial part of the antebrachium or the forearm. And to label these last branches of the brachial plexus, we're going to use the undergo mass misery from the mnemonic. The U is the ulnar nerve from C7 to T1, and in the anterior antebrachium, it innervates 1.5 of those 8 muscles. So it innervates the muscle that has ulnar in its name, flexor carpi ulnaris, and then it innervates the ulnar half of flexor digitorum profundus. Then in the hand, the ulnar nerve innervates all the intrinsic hand muscles that aren't innervated by the median nerve. And speaking of the median nerve, that is our next M here. It comes from C5 to T1. And in the anterior antebrachium, it innervates 6.5 of the 8 muscles, specifically the 6.5 muscles that are not innervated by the ulnar nerve. Then in the hand, the median nerve innervates 1/2 loaf, which stands for the first and second lumbricals, opponens pollicis, abductor pollicis brevis, and flexor pollicis brevis. Then finally, our last branch is the musculocutaneous nerve from C5 to C7, and that innervates the muscles in the anterior brachial compartment, like the coracobrachialis, biceps brachii, and brachialis muscles. Then the last part of our mnemonic is Robert Taylor drinks cold beer, and that's in reference to roots, trunks, divisions, cords, and branches of the brachial plexus. So first, looking at the roots, you can see we have the spinal nerve levels of C5, C6, C7, C8, and T1. And even though these are called the roots of the brachial plexus, these are actually ventral rami. So we're going to zoom in here to a spinal cord and see how that all comes together. So you can see off the spinal cord, we have a ventral root for motor and then a dorsal root for sensory. Then where those come together, that's the C5 spinal nerve for this level. Then from the spinal nerve, we have a dorsal ramus that heads towards the back, as well as a ventral ramus here. And it's these ventral rami that are called roots to the brachial plexus, but just to be clear, these are not ventral roots, they are ventral rami. So we'll zoom out here and now look at the trunks, and these are formed when the roots of the brachial plexus come together. So there's a superior trunk, a middle trunk, and an inferior trunk. Then the trunks give off divisions. There are 3 posterior divisions and 3 anterior divisions. The posterior divisions are all a part of Poseidon's ultra trident that we drew earlier, and even though there's a line, that middle posterior division is continuous with the middle trunk. Then you can see the anterior divisions highlighted in that darker bluish purple color. Then the divisions come together to form 3 cords, a medial cord, a posterior cord, and a lateral cord. Those 3 cords get their name based off their relationship with the axillary artery. And you can see the medial cord is medial to the axillary artery, the lateral cord is lateral to it, then the posterior cord is just hiding back there behind the axillary artery. Then the very last part of the brachial plexus are the branches that we'll highlight in purple here. And since we've already labeled all of the branches, our job here is done. So to recap, we learned how to draw and label the brachial plexus using Mark Nilsson's mnemonic. And we also talked about the function of each nerve. We primarily focused on the motor function today, but we'll cover the cutaneous fields for each nerve's sensory innervation in another video. And that is it for learning how to draw the brachial plexus.